Hi, I'm Bashi. I'm a speech language pathologist, and I'm going to walk you through some coordination and mobility exercises for your tongue. Sometimes after stroke, folks lose coordination and mobility with their tongue or have weakness on one side, resulting in difficulty with articulation and swallowing. We see similar changes with folks with head and neck cancer, folks who have experienced chemoradiation to that area of their body, and notice some changes in the tissue stiffness and strength. You might also have an anatomical change, a resection or a surgery or removal of a portion of your tongue as well that can affect its range of motion. So when thinking about holistically rehabilitating both speech and swallowing skills after a change in tongue mobility, we're also thinking about coordination and strengthening. These really focus on the coordination and mobility pieces with options to add in strengthening tasks as well. So for these first initial movements, what we're going to really focus on is holding each of them for 5 seconds, and then you're going to want to do them at whatever intensity and dosage your clinician recommends. So the first one, you're going to stick your tongue out as far as you can and hold it for 5 seconds. Next, you're going to try to touch your nose with your tongue. Some people are better at this than others. I am not very good at this one. Next, you're going to try to touch your chin with your tongue. Next, you're going to stick your tongue out and move it to the left corner of your mouth. And you're going to do the same thing to the right corner of your mouth. Next, what you're going to do is stick your tongue into the left cheek. And to the right cheek. This next exercise, you're going to press the tip of your tongue to the roof of your mouth just behind your front teeth, or where you feel that little ridge, your alveolar ridge, or the pizza burny ridge, as I call it, that spot that you burn when you bite into pizza and it's too hot. So you're going to keep the tip of your tongue pressed there, and then you're going to slowly open your mouth as wide as you can while keeping the tip of your tongue in that spot. So it'll look like this. Feel a lot of stretch underneath your tongue there. Next, what you're going to do is move your tongue as far back as you can, like you're yawning or gargling. So moving your tongue as far back in your mouth as you can. And then the last ones that you're going to do is pursing your lips like you're blowing a candle. And then pulling your lips in like you're trying to make them disappear. I typically recommend sets of 10 of these exercises, but really based on what your clinician recommends, given your unique needs and profile. But just making sure to rest in between. So you'll do an exercise for 5 seconds, completely rest and relax back to baseline, and then do the exercise again, however many iterations your clinician recommends. For the next few exercises, these are more of coordination versus how the other ones were a bit more focused on mobility. So this first one, you're going to move the tip of your tongue from the back of your front teeth as far back as it can go, kind of like you're trying to lick peanut butter off the roof of your mouth. So it might look like this. And you're going to want to complete these exercises about 5 times each, or as much as your clinician is recommending. The next one, you're going to move your tongue in a circular motion clockwise in the space between your lips and your teeth. So this entire space here, as far as your tongue will reach, is prime real estate. The further you're reaching will work on your mobility. And the coordination piece is being able to do it all clockwise, and then after that we'll do counterclockwise. Again, you're really wanting to look out here for any pain. A little discomfort and stretch is normal. It's like if you were starting out with yoga and you reached over to touch your toes, you're going to feel an intense feeling in the back of your legs as you stretch. That's normal and expected. If you felt a sharp burning pain in the back of your legs as you reach to touch your toes, that would be something to worry about. So really thinking about the difference here between like the discomfort of a stretch versus pain, which is your body's signal of like, hey, wait, that's too much. So really be mindful. No need to muscle through anything. Mobility and coordination are things that we gain gradually over time. It's just going to take a little bit. But staying really curious about how much further each iteration you're able to stick your tongue out, or how much further into the sides of your cheeks you're able to get with that tongue sweep. It's just really good information for how much your mobility might be impacted, and just how easily with a couple simple exercises those things can change and adjust. So back to this next exercise, you're going to move your tongue in a circular motion clockwise in the space between your lips and your teeth like this. Really functional exercise for anything that might get stuck in your teeth or in those little sulci there. You'll do that same thing counterclockwise. And then for our last ones, we're gonna lick the outside of your lips in a clockwise motion and then a counterclockwise motion. So just a really basic mobility rundown, really helpful all around, something you can do once a day, every day, several times a day. Really just looking for excessive fatigue, cramping, or pain, but just really engaging with these skills frequently and gently and mindfully is a great way to improve that mobility and coordination.